Metric I've read multiple times is in service-based businesses, 30% of phone calls get missed, right? And so think about being the patient on the other line, on the other side of the line, right? You're worried about something, you have some symptoms, you need a medication refill, and you're trying to just get through. Someone please pick up and listen to my concern, right? And they're just sent to voicemail. And you're in this nebulous time period of when you'll get called back. And on the other side, the medical assistant is swamped, right? They're trying to check in a patient. They're trying to take a phone call, trying to send in a prescription refill. So how do we balance all that? So for me, a big part of it was going offshore. We don't ever miss phone calls. It is not hard for me to hire if we start getting more patients, more phone calls, because it doesn't, break the bank. But especially in, my practice, if you're calling, you have chest pain, or, you had a friend that just had a heart attack, now you're concerned about yourself. You want to speak to someone, right? You want to speak to someone. You want that empathetic, compassionate voice that can help you out. And so I think that the initial call should go to a person. So I think it's a combination of delegation, with these offshore staff, and then automation, using the technology and AI. And so survive, and not just survive, thrive, so whatever tools I found that have helped me in my practice. And I talk about this a lot, there's doctor Facebook groups, private practice, doctor WhatsApp groups,
Really?
just trying to disseminate information. Because I think we all are kind of hesitant to talk about business, because like doctors are not supposed to think about the money, right? But frankly, if we can't keep the lights on, and we're not thriving in business, right? The good doctors are not going to be able to see patients. But yeah, I mean, it is getting harder and harder, to stay in business with increasing, inflation and our insurance reimbursements and competitions with hospitals.
And if you have a doctor, this applies to anything, not just medicine, but if you have a doctor who's not stressed about money, not stressed about staff, not stressed about lack of sleep, then they're going to do a much better job, and they're going to have time for research. They're going to have time to give you a better care. They're going to have time and money or resources to get additional staff so that you don't have to be waiting an hour in the waiting room after your appointment time, because the business side of it is thriving such that they can have everything else around it, and you as a patient get better care.